Ladies and gentlemen, I introduce the university singers to perform the national anthem. May I ask you to remain standing for the prayer? I'm going to invite Pastor Michael Lewis to the lectern at the center of the stage. You will have to walk to your left facing the stage, Pastor Lewis, to make your way to the lectern at the center. Please remain standing.
Shall we pray? Father in heaven, it is out of hearts of indebtedness and gratitude we assemble in this fashion to secure your blessing on this proceeding today. We pray for wisdom, we pray for guidance, and we pray that the objective of this meeting will be realized. We pray in a very marked way that you will superintend the process and allow for everything to be done to your name's honor and glory. It's towards that end we pray in Jesus' name. Amen.
Amen. You may be seated. Thank you. Good evening, ladies and gentlemen. This voice from the corner is now at center stage. I am Faye Ellington. Let me just remind you or tell you that Pastor Michael Lewis is from the East Jamaica Conference of Seventh-day Adventists, and we thank him for being here to share in this occasion. I'm all for encouraging young people. Could you put your hands together for the uniform groups? Dr. the Honorable Christopher Tufton, Minister of Health and Wellness. Dr. Joy St. John, Executive Director of the Caribbean Public Health Agency, CARPHA. Mr. Dunstan Bryan, Permanent Secretary in the Ministry of Health and Wellness. Acting Chief Medical Officer, Dr. Karen Webster Carr. Assistant Secretary Lois Pace, Health and Human Services, Office of Global Affairs. Our guest speaker, Dr. Peter Figueroa, Professor of Public Health, Epidemiology and HIV/AIDS at the University of the West Indies, Mona, Jamaica. Mr. Ian Stein, the PAHO WHO representative for Jamaica, Bermuda, and the Cayman Islands. Members of the Diplomatic Corps, directors of the Ministry of Health and Wellness, regional directors, regional technical directors, parish managers, medical officers of health, distinguished guests, members of the media, ladies and gentlemen, good evening. I did indicate earlier that I am Faye Ellington. Thank you for joining us this evening for the opening ceremony of the 66th CARPHA Health Research Conference being held here at the AC Marriott Hotel in Kingston from today, September 15, through to Saturday, September 17. This is hosted in collaboration with the Government of Jamaica through the Ministry of Health and Wellness under the theme COVID-19 and Digital Health, Transforming, Connecting, Informing Public Health. The conference is a combined in-person and virtual event. These days we say it's hybrid. I pause here to let you know, ladies and gentlemen, that this event is being streamed across the social media platforms of Jamaica's Ministry of Health and Wellness, and that, of course, is at the MOHWGOVJM. That's at the MOHWGOVJM, as well as through CARPHA at CARPHA1, CARPHA1. If you're watching from home, we welcome you. Pass the information on because this is such an important conference. This research conference, the largest of its kind in the English-speaking Caribbean, has a long history of bringing to the fore the difficult conversations that need to be had surrounding the various health and environmental challenges being faced in the region, while seeking to find tangible long-term solutions to them. This year's staging will provide participants with a platform to network and to share research and insights to inform public health interventions. First on our agenda this evening is Dr. Joy St. John. She rose to the ranks of public health in Barbados to become the first Barbadian chief medical officer in 2005. In July 2019, she became Executive Director of CARPHA and has led the CARICOM Regional Public Health Response to the COVID-19 pandemic. It is indeed my pleasure to invite at this time Dr. St. John to bring remarks. Dr. St. John? And we will ensure that the area is sanitized between speakers. Notice I'm using my mic, but this one is yours. Thank you for joining us.
Thank you very much, Madam Master of Ceremonies. The Honorable Minister of Health, Dr. Christopher Tufton, our distinguished speaker, Professor Peter Figueroa, Permanent Secretary, other distinguished speakers, conference delegates, conference planning team, CARPHA staff. Good evening. And since we are physically in Jamaica, what a guan. I bring warm greetings to you from the organizing committee of the 66th CARPHA Annual Health Research Conference. What a difference 15 months have made to the life in the Caribbean since we last met virtually for the 65th Annual Health Research Conference. I am so happy that we are in Jamaica as had been the plan in 2020. Although the virtual setting gave us a good conference experience, we listened to your recommendations, and we are here today to commence the 66th Annual Health Research Conference in the hybrid format. We are honored by your presence, both in person and virtually. Welcome back to all who have journeyed with us over these years, and welcome to those who will experience what the others before have, a real CARFA health research experience. I certainly assure you that the team has worked very hard to ensure that both the virtual and face-to-face experiences are worth your time and meet your expectation for this conference, an expectation that CARFA has been known to fulfill. In keeping with the theme of this year's conference, COVID-19 and digital health, transforming, connecting, informing public health, we have all witnessed and experienced firsthand with front row seats. Throughout this pandemic, all of the key words in this theme, transforming, feats of transformation of operations occurred in the education, tourism, and business sectors in order to continue work safely while the pandemic's most virulent variants were rampaging. We also literally morphed into a society that had to be tolerant while observing all the public health safety measures in order to keep ourselves and others safe. Connecting. I think the most popular new word in this world is Zoom, because when we could not meet face-to-face, we connected through Zoom. We had to learn the etiquette of online connections, while finding ways to make the connection as real as the virtual world would allow. We literally connected digitally as we disseminated information and increased telemedicine services, informing public health. One of the silver linings in the gray cloud of the COVID-19 pandemic was that people began to understand the true practice and meaning of public health through the varied responses to the pandemic. John and Jane Public had never before experienced such a public health threat and the global response that was required in their lifetime. So yes, COVID-19 and digital health have presented opportunities to really inform public health practice, administration, and research. It is my hope that young budding researchers have seized the opportunity to approach the topic using different lenses. The opportunities for restructuring the global economy, the impact of the changed paradigm of education on children and young adults, the impetus for reinvigoration of the Caribbean path to food security, improved nutrition and sustainable universal health coverage, to name a few. In this digital information age, we are mindful that communication strategies must be tailored in ways that take into account the strong influence of social media on the target populations and the changes to the dissemination of critical information and the heavy reliance on digital health methods, because not everyone who needs health care has access through this digital/virtual method. In many ways, this pandemic has prepared us for the next. We are already seeing this with how we respond to monkeypox. Therefore, in your future research, while we have embraced digital health, always remember the core values of public health, one of which is accessibility. It is your responsibility to craft research strategies that can be used to bridge the digital divide. To the Government of Jamaica, Ministry of Health and Wellness, the main financial contributor to this year's conference, we are tremendously grateful for your support opening your shores to welcome CARFA and all the research community of CARICOM and its diaspora, and for being the distinguished host country. Jamaica has been co-hosting the scientific conference now for the 17th occasion. That deserves a round of applause. It would be remiss of me if I did not remind our presenters, delegates, and attendees to remember to maintain the safety protocols of our host country, to reduce transmission of any of these viruses during this conference. Let us all remember to be safe and protect the safety of each other. CARFA is very happy to be honoring Professor Victor Blanchett and Professor Sirmani Harding, this year's awardees, who have been exemplary health innovators of public health in the region. Congratulations to all exhibitors, speakers, panelists, presenters, awardees, and delegates. This is all possible because of the tireless work of the CARFA and Jamaica planning teams. I say a heartfelt thank you to the Research Advisory Committee, who ensure the scientific quality of this annual event is second to none. I am delighted that the 66th CARFA Annual Health Research Conference, COVID-19 and Digital Health, Transforming, Connecting, Informing Public Health, is a reality. And I wish the participants and presenters success over these coming days. Again, welcome.
Thank you so much, Dr. Joy St. John. Thank you so very much for starting us off this evening. We are making sure that we do all the right things, and you did warn us to ensure that we, throughout the region, we ensure that we kept things. As a matter of fact, I'm not going to go there now because I want to introduce one of our celebrated dance troupes in Jamaica at this time, the Tivoli Dance Troupe, and they will be performing two dances for us. Carnival Vibe is the first, and then there's a modern dance called Movements in Time. Now, we have something in Jamaica called the Jamaica Cultural Development Commission. I know the videographers are going to get me for this because I'm standing here and not there. But the Jamaica Cultural Development Commission, we, and I say we because I have over the years been a part at different stages and places, ensure that our traditional dances, things that are modern, are given a space for growth and development. And this group is one of the groups over the years who've copped parish prizes, zone prizes, national prizes, so we know them as an outstanding group. Will you welcome them now to the space to entertain you? Oh, yes, the applause will be greatly appreciated. As performers, we thrive on applause. And this is just a fraction of the group, you know. I am giving space so that when they come back, you know, they can get into position quickly. But they range from little ones, 5 up to 30 and over. And when you see them fill the videographers need the space and the dancers need the space. When you see them fill the national arena, the stage there, it's color, it's energy, it's vibrancy. So will you welcome them now with a second performance of, by the way, before I go there, did you notice a young man who kin pupalik? How many people in the Caribbean know kin pupalik? Ah, it's called a somersault. In Jamaica, we say your kin pupalik. So you've learned one additional thing to go back home. All right. So let's put in modern dance at this point, and this one is Movements in Time. The Tivoli Dance Troupe. I hope you saw the jeweled masks. Nobody saw the jeweled masks? Well, clap them. Clap them. There are 2 women who've worked with this group. Let me just put my mask over my fingers. There are 2 women who've worked with this group for many, many years. They're at the back of the room. And I know that I would just like to acknowledge them and recognize them. Jennifer Garwood. And yes, they're waving at me at the back of the room. And Roberta Daly. These groups don't happen on their own. There have to be people who choreograph, arrange rehearsals, arrange transportation, arrange welfare stuff, you know. People have to eat and drink and the rest of it. So, and a lot of this is volunteer work. A lot of this is volunteer work. And now, It is my pleasure at this time to introduce, he's taking a note or two, but I know he's agile. He'll be here momentarily. Our Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, one of the most energetic, hard-working champions of public health, I can say, in the region and beyond. But please, I would like you all to know, don't tell him I told you, I'm the reason why he's exercising as regularly as he does. He will tell you if I'm correct. Could you welcome Minister, please?
Thank you very much, Ms. Fay. And I'm the only one allowed to call her that, okay? Thank you, Madam Chairperson. Always a pleasure to see you, and you're right. I'm always encouraged by you, including with the physical activity. Only the Tivoli dance troupe can do it the way they do, right? I really enjoyed the performance, and I want to really encourage them. Executive Director of the Caribbean Policy Research Institute, my friend and colleague, Caribbean Research Health Agency, let me be clear, Dr. Joy St. John. Welcome again to Jamaica, and thank you for hosting this very important seminar, workshop, research conference, and for attracting so many non-Jamaicans who are now honorary Jamaicans. And I'd like you to all spend some tourism dollar while you're at it, okay? We have Kingston is a great place with a lot of vibe and spirit and energy. So welcome to you and your staff. Dr. Peter Figueroa, Professor of Public Health, Epidemiology and HIV/AIDS, the University of the West Indies, Mona, an old veteran, as they would call it in public health. Good to see you again, sir. Mr. Ian Stein, the most recent to the block, but who has been so much around the place. He appears as an old-timer now, right, Ian? Who is the PAHO WHO representative for Jamaica, Bermuda, and the Cayman Islands. My team, led by Mr. Dunstan Brand, the Permanent Secretary. Good to see you, sir. And our acting CMO, National Epidemiologist, Dr. Karen Webster Carr, who I've never seen her. I don't know what she looks like because she has never taken off the mask. If one of you can get her to take off the mask, I'd give you some money, right? She's, but excellent public servant and public health servant. And to the rest of the team at the Ministry of Health and Wellness, the regional directors who are here, the regional technical directors, parish managers, all the staff members, the communications group, and others. To members who are out there in the technology land, as they would call it, representing, I'm hoping, all the countries of the region. I would like to say welcome to Jamaica virtually. And to those who have traveled to be here, thank you very much. This is indeed an important occasion for us, not just here in Jamaica, but for the region. I really like when the region comes together, supported, of course, by others who are extra-regional or in the hemisphere, because it gives us an opportunity to reflect. And now more than ever, in a post-COVID, even though we still have COVID, it is a period for reflection, renewal, and recommitment. And I think ultimately the 66th Annual Health Research Conference, and particularly the theme, COVID-19 and digital health, captures the essence of really what is required. So really want to say commendations to CARFA, Dr. St. John, her leadership, and her team for doing the work. I know this has been taking a lot of planning, and indeed my own conversations with her from as way back as almost a year ago, I think, trying to pull together and play our own little part. I know that she has put a lot of effort in this. So the conference and a suite of related activations, including the town hall at the University of the West Indies on Tuesday, and last evening's launch of Caribbean Moves. I don't know how many of you, first of all, the town hall was great. I tuned in a little bit, wasn't there physically but virtually, and I want to commend those who participated. The Caribbean moves, though, I was present at, and I tell you, if you want to see Dr. St. John drop her foot, I have a little video on my phone. She really enjoyed it, didn't you? And so did all of us who were there, and those also out in the virtual space. Again, it was really amazing to see Caribbean people dancing away. And as my message said yesterday, you don't need alcohol or any foreign agent to intoxicate yourself. The Caribbean culture, the music, and the camaraderie does a very good job at it. So that was good. Meanwhile, the research conference, of course, is an important, and it is timely as we seek to build back better with and after the COVID-19 pandemic, which has put our health systems regionally through their paces over the last 2+ years. Real challenging period for public health and for all who participated. In this context, research is integral to the success of those efforts, including, of course, an investigation of what worked and didn't work in our COVID-19 response, from treatment outcomes to the nature and the quality of our varied interventions, including, which is part of the theme, the ICT interventions to safeguard continuity of care. And I think it is very good, very apt that we are not just reflecting on what went wrong and what represented the past or even the present, but how do we move forward? Today I spoke at another forum earlier this morning, a research conference, and I indicated that COVID should now, or our view and perspective towards COVID should now shift from a threat to the opportunities. And that's what this conference, I believe, represents. What are the opportunities that can flow out of COVID? So I welcome the focus of this year's conference, COVID-19 and digital health, transforming, connecting, informing public health, which for us here in Jamaica aligns the strategic priorities of the Ministry of Health and Wellness. Those priorities include the prevention and care management of non-communicable diseases, which clearly is a big issue for all of us and is a challenge that we will have to confront. That is, in fact, the global pandemic that is ongoing, and that's the one that we will have to take on. Cardiovascular diseases, cancers, diabetes, chronic respiratory diseases are the, of course, leading cause of death, over 80% of deaths in the region and the Americas. And the risk factors, obesity, overweight, high blood pressure, physical inactivity are common characteristics within our culture. However, I would like to say that this conference helps to generate hope for us to overcome these challenges, because it is bringing the capacity of the region together and outside to reflect, to look at the interventions. And in our case, we are proud and happy and very willing to share the experiences of Jamaica, because we have, I would like to say, all 23,000 of us in public health, supported by the government and our stakeholders like Prof. Figueroa and the university and others. We have embarked on a reform process, a restructuring process here in Jamaica to capture the opportunities of COVID and to build resilience. And I believe all islands in the region, all countries would have started at least something. And I think sharing these ideas at this conference represents a very important thrust to learn from each other's experiences. Our health system strengthening program, for example, has a significant component around digital health. We are embarking on the most ambitious digital health program, I suspect, maybe in the region, perhaps by virtue of our size, the largest English-speaking Caribbean country. We're spending over $8 million, and that process has started. In fact, we are now placing the hardware and the connectivity in over 120 health centers and hospitals, and we'll soon announce the contract for the software provider to place on top of that the health information systems. I don't need to explain what the benefits are of that, but just to emphasize that what we hope to come out of that, separate and apart from reducing transaction time and cost and being more efficient in delivering health services to those we serve is a sharing of those expertise regionally and beyond. Because the future of public health and health, I should say one health, whether it's public or private, is that no man is an island. None of us will stand alone. And if we put the infrastructure in place, like digitization, it will help us to share ideas and to provide the opportunities so all can benefit. Equality of access is a big theme, and I think that will help the process. So I'm here to welcome you, to say thank you for being in Jamaica, to say enjoy your stay, those who are visiting with us, and let us use this platform to learn, to share, and to build as we seek to create a one health, better world. Thank you very much.
Thank you, Minister Tufton. We are now preparing for perhaps, ooh, that's okay. Microphones do that when they're not turned off before we wipe them. Yes, it gives me great pleasure this time to introduce what I would think the most outstanding choral group, the most distinguished choral group in the Caribbean. Their home is at the University of the West Indies, but they have performed throughout the region, in North America, and beyond. The university singers are preparing to come on stage, return to the stage at this time to perform a medley of songs. I know you will enjoy this. Could you just put your hands together to welcome them, the members of the university singers.
Say your greasy shirts, white clothes and powder, striped, clad and checkered. We can give them a good rub. We can give them a good scrub. For it's wash day down a riverside, nearly water flow. It is wash day down a riverside. Who could breeze up flow? The river was with big wash down. Rub. Hang up clothes, we don't make clothes line. See the cursing fan, we white clothes are white. It is wash day down a riverside. Sheet a pillowcase. It is wash day down a riverside. Curtain trim with lace. We help one another and we never charge. We wash my bikini and extra large. Silk and brown cotton. Tear up one and some without. It is wash day down a riverside. Hear the water flow. It is wash day down a riverside. Who could breeze up flow? Hear the water run. Put your clothes on sun. Come and join the fun. Wash day. Wild breadfruit, all breadfruit. breadfruit are the same breadfruit.
If you want to know how the breadfruit sweet,
Catch a piece of the corn pork meat. And when you catch it with the salt mackerel,
Boy, and the saltfish, and the coconut.
then you rock back and lick your big finger.
oh, you know have to wonder how the breadfruit sweet. It's sweet, it's sweet, it's sweet, so sweet.
Roast dumpling, wild dumpling.
All dumpling are the same dumpling.
If you want to know how the dumpling sweet,
Just catch a piece of the corn pork meat. And when you catch it with the salt mackerel and the saltfish and the coconut
then you rock back and lick your big finger.
oh, you know have to wonder how the dumpling sweet. It's sweet, it's sweet, it's sweet, so sweet. Oh, Lord, it's sweet.
When we roast the yellow yam,
Roast the yellow yum,
and we slice it into two.
and we slice it into two.
How nice it will be!
Nice it will be.
With the hockey and the salt fish
And the fish
and the white flour dumpling
stick into my teeth.
and the coconut oil.
And the coconut oil. What a glorious day! Glorious day. When we roast the yellow yum.
Bum 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 bum.
When we roast the yellow yam,
Bring it quick and make we yum.
and we slice it in a two.
Peace be me and peace be you.
How nice it will be!
How nice it will be.
The hockey and the salt fish
Full up me dish.
and the white flour dumpling
Stick under me ribs.
and the coconut oil.
Make sure it lasts while. What a glorious day. Glorious day. When we yam the yellow find the strength to press on.
And now the blessing that reach me, I share them. The shop back coming to one big jam and class. So from shopkeeper, post Mrs. and I am the teacher, I'm moving up fast. Believing one thing lead to another, and it is plain for who to see. For I am very, very proud to tell you that last week I was made a JP.
One thing lead to another, so when faith and courage is gone, me just look over my shoulder, see where me coming from, and I find the strength to press on.
So I am happy, I am never complaining. For when life opened up before me a door, I just thank God as I try to pass through it. For that door leads me to anymore. So day by day we just a spread out and prosper right here on this very spot. And I just thank God for His guidance, and I thank Him for all that I got.
One thing lead to another, so when faith and courage is gone, me just look over my shoulder, see where me coming from, and I find the strength to press on. One thing lead to another, so when faith and courage is gone, me just look over my shoulder, see where me coming from.
And I find the strength to press on.
One love, one heart. Let's get together and feel alright. One love, one heart. Give thanks and praise to the Lord, and I will feel alright. Let's get together and feel alright. Let them all pass out their dirty remarks. There is one question I really love to ask. Is there a place for the hopeless sinner who has hurt all mankind just to save his own soul? One love, one heart. Let's get together and feel alright. One love, one heart.
from the University of the West Indies, the University Singers. A splendid performance, like only they can. Thank you so very much. The group is much larger than this, so you got a taste of what they have to offer, and their repertoire is quite extensive. They have an annual season each year, and so many of us clamor to see their performances. I will tell the University Singers, though, all of you back there, including Heston Booth, etc., you see you're performing for health professionals, and all you could sing about is saltfish and salt mackerel and flour dumpling. It's health professionals. We are here with you know, and you know them tell you to cut down on this salt. And you are just promoting saltfish, salt mackerel, and mercy, Father, no, and flour dumpling. They're not inviting you back next time, you know. No, man. We do really like the breadfruit song all the same. And you have to really have it with a little saltfish, salt mackerel. It's a Caribbean thing. Put your hands together one more time for them. We are at that spot in the program when it is my pleasure to introduce the guest speaker. And this evening's guest speaker is Professor Peter Figueroa. He's been unwavering in his contribution to public health in Jamaica and the Caribbean, which he has served with distinction since the 1970s. He has, among other things, contributed to the movement that developed primary health care in Jamaica, including the introduction of community health aids in advance of the 1978 Alma Ata Declaration. Professor Figueroa was awarded his PhD in 1996 by the School of Hygiene and Tropical Medicine, University of London, and has written or co-authored more than 150 published papers and co-edited 3 books on a range of public health topics. He currently serves as a professor of public health, epidemiology, and HIV/AIDS at the University of the West Indies, Mona, and was a national epidemiologist in Jamaica from 1986 to 2008. And some of us who worked in media will remember his being so available to ensure that whatever it is we needed to question or get information on, he was there. During this time, he led the National HIV/STI program. Professor Figueroa also served as Chief Medical Officer for Jamaica from 1997 to 2002. Who better to address us this evening? Ladies and gentlemen, will you help me welcome Professor Peter Figueroa. I'm going to touch this mic, Prof, but just to bring it up for you and move it over here for you. Good.
Thank you so much, Faye. I do appreciate your kind words. Good evening, everyone. Honorable Minister, Permanent Secretary, Acting CMO, or Director of CARFA, distinguished dignitaries, colleagues, and friends. It really is an honor and a privilege for me to address you. I spent 17 years as a scientific secretary helping to organize this annual meeting. So it's good at home to see the meeting here again. This evening, I would like to just say a few words to stress the importance of research and to share some of the achievements of Caribbean health research and give you a little bit of the history of this annual conference. We know that without research, we do not know what treatment really works, what preventive measures work, or whether our tireless efforts and hard work are making the difference that we want, namely preventing disease, curing illness, and promoting health. Systematic research over years builds the evidence that guides medical care and public health. Health research is a challenging field. It requires serious application and discipline, a systematic approach with careful attention to detail. It requires a wide range of expertise and is often best done in a multidisciplinary team. Astute observation and critical acumen are helpful, but not enough. It certainly needs more than common sense. Our recent experience with COVID illustrates this well. You will recall that there were many voices initially calling for the use of hydrochloroquine, ivermectin, and other products that seemed, on the basis of clinical observation and observational studies, to be helpful. But when the trials were done, it showed that, in fact, they really did not make any significant difference. Observational studies often have bias or confounders that may not readily be seen. The randomized controlled trials are definitely more robust and less likely to be biased once they're done properly. It is of critical importance that our Caribbean governments support high-quality research. This requires training a wide range of professionals. A huge challenge for researchers in the Caribbean is finding the funds to support the research that needs to be done. It pays to invest in research, and more funding must be made available to support research in the Caribbean. The scope and quality of health research in the Caribbean has grown considerably in the past 70 years. And this research has had a profoundly positive impact on the health of the Caribbean people and contributed to the improvements of health globally. And I will illustrate this with a number of examples. If we go back as far as 1881, it was a Cuban epidemiologist, Carlos Finley, who established that yellow fever was transmitted to humans by the Aedes aegypti mosquito as a vector. The bacteriologist Joseph Parwan from Trinidad and Tobago established that the outbreak of human rabies, resulting in 89 deaths in the 1930s in Trinidad, was due to the vampire and fruit-eating bats. The Barbadian doctor Harry Bailey demonstrated that outbreaks of jaundice in Barbados were due to leptospirosis and not yellow fever. He also developed treatments for the sting of the lionfish and for larva migrans. It was an Italian doctor, Giglioli, who identified Anopheles darlini as the main carrier of malaria in Guyana, and his extensive research actually led to the interruption of transmission of malaria in coastal Guyana, which unfortunately, resurged and reestablished itself. In the 1950s, astute clinicians at the University College of the West Indies described a number of diseases and disease syndromes, including Jamaican neuropathy, now known as TSP-HAM, tropical spastic paresis, or HTLV1-associated myelopathy. We know that this retrovirus causes adult T-cell lymphoma leukemia, which is a very serious cancer that is usually fatal within a few months. Persons with this cancer are actually infected during infancy through breastfeeding when a mother is infected with HTLV1. However, this can be avoided by testing pregnant women for HTLV1 and advising the mothers, if infected, to limit breastfeeding to no more than 3 months. This is a program that we need to look at introducing, certainly in Jamaica, and some of our other Caribbean islands. Bush teas used to be used far more extensively in the past. And again, it was clinicians at the hospital in Mona who identified that some of the bush teas, crotalaria, wildback, king of the forest, were causing veno-occlusive disease of the liver. And an educational program advised the public to stay away from those bushes and just stick to mint and other such bushes that are not harmful. Of course, Jamaican vomiting sickness was found to be associated with hyperglycin, an agent that depressed the blood sugar in unripe ackee. And then it was the stories of fishermen fishing at night who said that their eyesight was improved when they smoked ganja that led the pharmacologist Manly West and the ophthalmologist Albert Lockhart to actually research it and develop the eye drops, Canasol, which are used for glaucoma. And there are other such examples of research in the Caribbean. We obviously can't go through all of them. But just to give a little more history, it was the Rockefeller Foundation that established the Tropical Research Viral Laboratory in Trinidad in 1952. And this lab did a lot of important work on arboviruses, including yellow fever. And it was rediscovered in Trinidad in 1954 after being absent for 40 years. The TRVL actually described over 1,500 different strains of arbovirus, including 19 distinct strains that were new to science. And they named them after the Amerindian names. So for instance, Mayara or Rapush were really indigenous names, and they gave their names to the strains of the arbovirus. In 1961, the administration of the Tropical Research Viral Lab was transferred to the University of the West Indies. And following the polio epidemic in Trinidad in 1972, I was actually in my final year in medicine in Trinidad when that epidemic broke, and unfortunately, Carnival was postponed, and I had to come back to Mona to take exams and miss Carnival. But the Prime Minister at the time, Dr. Eric Williams, proposed that the lab could become a center for communicable disease in the Caribbean. And this initiated a process leading to the transformation of the Tropical Research Viral Lab to become CAREC, the Caribbean Epidemiological Center. And this was finalized in 1975 when it became a PAHO center serving the Commonwealth Caribbean and played a critical role in developing disease surveillance and capacity throughout the Caribbean. In 2006, the Caribbean governments initiated a process to rationalize and unify all the regional organizations that were in the Caribbean, not just CAREC, but also the Caribbean Food and Nutrition Institute, the Caribbean Environmental Health Institute, the Caribbean Regional Drug Testing Lab, and the Caribbean Health Research Council that was responsible for running these annual conferences and promoting research throughout the Caribbean. And after some delay, this gave rise to the formation of CARFA in 2013. And one of our local doctors, Dr. Barry Lyons, played a role in bringing that together. But if we go back to the origins of one of the most important developments with respect to the development of health research in the Caribbean, it was in 1954 that the Tropical Medicine Research Unit was set up as a MRC, a medical council unit in Jamaica on the campus, and it was headed by an Englishman, Dr. John Waterloo. Now, this unit actually pioneered significant research in the fields of malnutrition, human metabolism, and child development. And this helped to transform these fields and had international impact on the health of millions globally. This is well documented by many of the leading researchers in an outstanding book called the TMRU UWI Jamaica 1956 to 206. But it has a subtitle, The House That John Built. And I would recommend it to you, any of you who are interested in serious research. It is essential reading. During the 1950s in Jamaica and globally, malnutrition was a major problem. Maybe 1 out of 3 children. Many were dying from marasmus and kwashiorkor. And the TMRU's research transformed the understanding and management of severe malnutrition. And the scientists at TMRU ensured that this research was translated into clinical practice throughout the Caribbean. And this is something that as researchers, we always need to bear in mind. Yes, we do the research, we publish it, but we should also really try and support the process of translating that research into practice to reduce the time span that it takes to bring the best practice based on the research. And they did this through working through WHO, FAO, and other organizations internationally. The TMRU's contribution included research into the cognitive development of disadvantaged and malnourished children, and the importance of stimulation through maternal interaction and play on the child's development. Members of the research team that did these studies to this day are helping countries in Africa, Asia, and the Middle East, as well as the Americas, to implement public health programs that provide stimulation to disadvantaged children. Follow-up studies over 30 years have shown that malnourished children enrolled in the initial research show that stimulated children are more likely to do better in school, they're more likely to be working than unemployed, and as adults, they are less likely to be involved in crime, and their mothers are less likely to be depressed. It is good to know that this program is now being rolled out in Jamaica. Community health aides visit the home of disadvantaged children and teach the mothers to play and interact with their children in a loving and supportive way, giving them positive reinforcement for good behavior and avoiding verbal or physical abuse, which unfortunately is too common in the upbringing of many of our children. This program needs to be fully supported and expanded to all disadvantaged children. And over the long term, I am convinced that it will help to reduce the violence which plagues our country. This program of teaching mothers and parents how to look after their children promotes the emotional intelligence, the self-confidence, and self-esteem in the children. It reduces abuse and trauma. Traumatized children are more likely to get into conflict and participate in violence. So this is a critical program. There are other very important fields of research that have been conducted. There's the work that has been done in sickle cell that has transformed the understanding and management of sickle cell anemia. We don't have time to go into that. The directors and scientists of TMRU have played an important role in the development of health research in the Caribbean alongside the UWI. And to go back to the very start of this meeting, it was in 1956 that it was called the Standing Advisory Committee for Medical Research. And Dr. John Waterloo was the first scientific secretary of this committee, and he served until 1961. When the countries became independent, then the CARICOM Treaty of Chaguaramas in 1973, the Standing Advisory Committee became the Commonwealth Caribbean Medical Research Council, and we later changed the name to the Caribbean Health Research Council. And this council met annually, consisted of the chief medical officers as well as representatives of UWI and the University of Guyana and a number of eminent scientists. And it was this council that actually got the annual scientific meetings going. And in those days, it was virtually the only Caribbean scientific meeting. And it really played an important role in promoting research. One of the important steps, of course, was the development of the Chronic Disease Research Center in Barbados. And I remember when Henry Fraser put the idea forward in the early 1990s, and he is the one who actually led the development of that and became the first director. And we know the good work that that center has been doing, especially in the area of chronic diseases. In Jamaica, the Epidemiology Research Unit of the TMRI has also done a wide range of population studies to estimate the burden of NCDs and focus on hypertension and diabetes and associated risk factors, because we know that this is a tremendous challenge in the Caribbean. So the ERU and CDRC has provided tangible evidence of the need for policies to promote and support the structural change in the diets, level of physical activity, lifestyle, the use of tobacco and alcohol among Caribbean people. And we really have to commend those of our leaders, like our own minister, who have taken up the advocacy on behalf of all of us to try and press for legislation to put these structural changes in place. Yeah, I think this needs to be recognized and encouraged, and we need more voices advocating for these changes. At the same time, we as clinicians, not only as researchers, have to look at the fact that although the prevalence of chronic diseases are so widespread and high, for instance, hypertension ranges from a prevalence of 21% to 38%, nearly 1 out of 3 in some of our countries. Less than 1/3 of hypertensive patients are adequately controlled. So again, it means that we need the operational research to better understand why is it that we're not more effective as clinicians to be able to better control the hypertension and diabetes that so many of our people suffer from. And a huge challenge that is facing us is that of obesity. And the university singers gave us a little insight into how difficult it is to deal with that challenge. There is no question that the Caribbean has an important tradition of high-quality research and has made a considerable contribution to understanding the patterns of local diseases and to improving the health of the population. Caribbean researchers do face significant challenges. You know, it's hard to compete for international funding. When I was doing research over the past few decades, it was easier to get international funding. There's a shortage of key specialists, biostatisticians, and a number of other specialists who you need to support the work. At the same time, it's critical for us as Caribbean researchers to keep abreast of current developments in our field. We must identify where we have the comparative advantage or indigenous resources or opportunities, and then we can forge productive partnerships with international researchers with whom there is mutual respect and areas where we can show them that we have a comparative advantage. While challenges are inevitable and the need for hard work is unavoidable, there's no shortage of creativity, commitment, and motivation among our best researchers who will continue to produce high-quality research and contribute to the improvement of the health of our people. In closing, I want to pay tribute to our health professionals throughout the Caribbean. These past 2 years with the COVID pandemic have been rough. Most health providers have been working around the clock. When we are responding to a disease outbreak, especially a pandemic, we have to be proactive and decisive and seize the initiative. We have to do this in a way to build the confidence of the people and guide and support their involvement in helping to control the outbreak. There is no magic bullet. So we have to be open and transparent and explain as best we can the reasons for our actions and that we feel need to be taken. In responding to COVID, there is much that we have done well. To this day, the rapidity with which COVID vaccines were developed provokes a question and doubt in the minds of some people. Despite all the challenges, the heroic work ensured that medical care was provided to the sick and measures were taken to limit the spread of disease. At the same time, we have to do, as the minister said, a serious assessment of our weaknesses. If we look at COVID vaccination coverage in the Americas, the countries with the lowest COVID coverage, 11 countries are in the Caribbean. We have the lowest coverage, where historically we have led the world with vaccination and the elimination of diseases preventable by vaccines. Polio, measles, rubella, congenital rubella, diphtheria, tetanus. We have led the world. So we have to ask ourselves, why is it that we're at the bottom of the class when it comes to COVID vaccines? And I think part of the reason is that whereas most of the countries in South America have some infrastructure in place to give adults vaccines, we have not set up an adequate infrastructure for COVID, to take vaccines to our adults. Now, 50% of adults in Jamaica seek care in the private sector. So we have to fully involve our general practitioners and our specialists in the private sector in ensuring that we do better with adult vaccination. And digital health, which is the theme of this conference, plays a critical role in helping to achieve that more efficiently, both with the reporting of diseases as well as the reporting of vaccines given and providing feedback to the field, keeping the field in touch with what needs to be done. It is so critical to stay in touch with your practitioners, with your researchers, in that constant feedback loop so that everybody can be fully involved. I regret to say COVID is not yet over. We did a recent survey, and the majority of persons in Jamaica have been exposed to COVID. But simply because you've been exposed to COVID does not mean you cannot get it again or a new variant may not develop. We do need a better COVID vaccine, one that prevents transmission. They're now testing out vaccines in China and India that give mucosal protection, nasal spray, that may make a difference. We have to continue to get the message across that the current COVID vaccines do protect well against hospitalization and death. The COVID pandemic set back routine childhood vaccination. Prior to the COVID pandemic, 19 million children were unvaccinated globally. Now we have 25 million children that are not vaccinated. In the Americas, in 2012, we had 94% coverage of our childhood routine vaccines. By 2019, it had fallen to 84%, and following the COVID pandemic, it is down to 80%. We need to recognize that we have got to turn back that tide and get the vaccine coverage, the routine vaccine coverage among children back up. We now are seeing circulating vaccine-derived poliovirus in New York, London, and Israel. If the vaccine coverage falls, as it has done in New York, you're going to see polio. We cannot afford that in the Caribbean. We're still seeing measles after 4 years in Brazil. We don't want that in the Caribbean. We're seeing diphtheria in Haiti. So this is one area, the value of vaccines. Vaccines, in my mind, are probably the most cost-effective intervention that we have in healthcare. And we really have to get that message across to our people that the vaccines that we are presenting to them are worth taking. Of course, we also have to do the healthy lifestyle and the moves and this, but we're still going to eat the breadfruit and the mackerel and the saltfish. Thank you.
Professor Figueroa, may I ask you to just stay on this stage for me? I'll take that for you. Could you go back to the platform, please? What a history lesson. What a lesson on research. What escaped me a while ago, did you say it's now down to 80%?
In the Americas.
Okay.
In the Caribbean, we're not quite as bad as that.
Okay.
But we have to look at the Americas as a whole.
So I wasn't certain, so the what escaped. I don't know if you know this person who's about to enter the stage, Professor. But could you go up and I'll introduce her?
That is why you kept me up here.
She has on a mask, but I think you know her. Director of Surveillance, Disease, Prevention and Control at CARFA, one Dr. Lisa Indar. I think you know this person quite well. Showing appreciation for your contribution here at the opening ceremony. Yes, thank you so very much. And Professor Figueroa, you can rest that here, but you need to go back there. Yes, you can rest that here. Thank you so much. And I'm now going to ask Dr. Joy, you have to go up. Both of you are going to be unveiling that plaque that is there. I don't know if there's anyone from the planning team who will assist you, telling you how to move it and then, to get it done. Dr. Joy St. John and Professor Figueroa. They will now be unveiling the commemorative plaque to signal the official opening of the 66th Health Research Conference. And I would like to invite Minister as well. Minister Christofton, could you join them there, please? Now, I'm not certain. I see two Hang on a moment. Mr. Brady, will you guide them and tell them how to proceed? Because we want it to happen right. All right? Just a moment. All right, so just take your instructions from Mr. Brady, please. All right, hang on there. So after 3, 1, 2, 3. Oh, it's simple. Very nice. Thank you, Minister. Thank you, Dr. St. John. Thank you, Professor Figueroa. Thank you so much. Have the photographers captured? Have you captured, everybody? Yes, videographer, you good? Yes, okay. Wow, what an evening. Ladies and gentlemen, we've come to the end of this part of the evening. Perhaps I should say now that we have brought the curtains down, but in fact we've opened the curtains to expose the plaque. And we appreciate your participation. We appreciate your attendance. I would like to wish for you a successful rest of conference, because this is indeed important as you make your presentations. I could see 3 presentations went today that were really very important. Wish I could have heard some of them, but there's so much more to happen. So we wish you every success as you go through the conference, the 66th CARFA conference. It's not done. The evening is not over. We'll have you here for another 5 hours. We're going to ask you to listen to the sound of the drum, and you will follow the sound of the drum into the reception area. Enjoy your reception, and thank you so much for being here and sharing in this occasion. So listen for the sound of the drums, and somebody from the ministry, I think Minister is standing, so he will lead the cause to the reception area. You can hear the drums out there. Right. Yes, So, yes, great. Sound of the drums, everyone. Allow the distinguished guests to go first. Oh, no, they're going to do pictures again. Okay, so you may go until the distinguished guests make it